Chapter 1. Understanding your health. Asking the right questions. To find health should be the object of the doctor. Anyone can find disease. Andrew T. Still, MD, founder of Osteopathy. Question 1. What brings you here? What brings you here? This is the question I use to begin every consultation. So it's the question with which I begin our time together in this book. If you were sitting across from me in my office, we would try to get to the bottom of the following questions. Why have you come to me? Are you suffering from a particular condition or ailment? Are you trying to understand why you're feeling a certain way? Are you frustrated with the contradictory information and limited guidance you've been receiving from others? Have you gotten too much information, and has that confused you about where to begin? With all that you read and are told by others, do you really understand what it means to be healthy? Unlike most doctors, I really want to spend time on your questions. They show me where you are on the road to health. Are you asking good, skillful questions? Think of it this way. You might have the intention to get to New York City from rural Pennsylvania. But by asking for directions to the big city with all the buildings, you might very well wind up in Philadelphia. Philly's a good town, but it's not where you intended to go. Similarly, if you don't know where you are right now, it will be impossible to find the right road to where you want to go. The fact is, you probably don't need to think too hard about what's bothering you right now, but you do need to refine your questions in order to reveal the path to true health. So, we start our consultation together with a series of intelligent questions. In general, they can be answered yes or no. This first one, for obvious reasons, is different. As you gain more insight by asking and answering these questions, you'll get a glimpse of a much more optimistic framework for living your life. On a much more interesting journey, I might add. Ultimately, you'll find a more sensible path toward healing. I've spent a long time walking and studying that path. I'll tell you more about my journey later. For now, I want to get straight to you. Why have you come to me? Like millions of us, you've probably got some health issues, and some of them might seriously diminish your quality of life. You might suffer from diabetes, hypertension, cancer, arthritis, headaches, ulcers, back pain, or a host of other very common and very unpleasant chronic conditions. You're not alone. According to the Centers for Disease Control and Prevention, more than 133 million Americans, 1 in every 2 adults, suffers from at least one chronic illness. The percentage of children and adolescents with a chronic illness has more than quadrupled since the 1960s. And chronic diseases cause 7 in 10 deaths in the United States each year. You've probably tried a lot of solutions, several doctors, several specialists, several drugs, several alternative cures, and maybe even several invasive procedures or even surgeries. If you've been suffering for years, you're probably like the vast majority of Americans, a whopping 72%, who believe the healthcare system in America is facing both crisis and major problems, in part because it can't seem to help you and those other millions. In any case, if you're dealing daily with chronic conditions, you don't need much in the way of reminders and statistics. What's wrong with this picture? How is it possible that we live in the most technologically advanced period in history, in the richest nation in history, where research, science, and the quest for health and longevity reign supreme, yet so many of us go on suffering needlessly with nasty conditions that are largely within our control? Is it really okay that 16% of our country's wealth is spent on medical care? More than any other nation. Yet there's precious little evidence that our extra spending makes us healthier. Indeed, we rank only average or below average for health among highly industrialized nations. Why is it okay that so many new drugs were approved by the FDA in the past several years? Billions were spent on medical research. Doctors got supposedly better and better educations. But the rates of chronic ailments like diabetes and obesity are dramatically rising rather than falling. I'm trying not to sound shrill here, but it's hard. The system is not serving us well, and it's on the brink of collapse. Meantime, you're still sick, and that's the most important thing.